Welcome. I'm Dr. Vinay Prasad. I'm a hematologist-oncologist, and I'm Associate Professor of Medicine at the University of California, San Francisco. In my professional life, I see patients, I teach trainees, and I do research in healthcare policy. This is Plenary Session. Plenary Session is a podcast at the intersection of medicine, oncology, and health policy, and you're listening to Season 3. On this week's episode, we got Robert Freudenthal. Dr. Freudenthal is a psychiatrist, and he is a thoughtful commenter on SARS-CoV-2 policy from the UK. You won't want to miss this discussion. You know, normally every week you hear me say, if you're a fan of this show, go support us on Patreon, you get access to the slides. I got something new to say this time. I think the good old days are over. We're living in a unique time where people are very happy to extinguish voices and ideas that they deem unfit for consumption. And so I personally have gone on Patreon. I've supported a number of people who I listen to, the podcast that I love, and I'm encouraging you to do the same. The only way we can combat this growing force of illiberalism is to support with our dollar bills podcasts we enjoy. So that's my plug. I'm back in Plenary Session, and I'm joined via Zoom by Dr. Robert Freudenthal. Dr. Freudenthal is a psychiatry registrar in the UK. He works in London. He's in his penultimate year of training, and he offers a very interesting perspective on the COVID pandemic. Dr. Freudenthal, it's a pleasure to have you here on the podcast.
Thank you. It's great to be here.
I have, had a great deal of admiration for your tweets and your thoughts over the last few months. And I'm glad I finally was able to pin you down and be able to talk to you about them. So thanks so much for doing this. Now, I wonder if by way of background, I might sort of give listeners a sense of where you're coming from on this issue. We talked a little bit before we started recording. You're somebody who, I think you're like me, you're somebody who identifies on the political left. You have many progressive values, and you are also someone who is interested in the role of the state and the powers of the state. I wonder if you might talk about that a little bit. Even before COVID-19, where did you find yourself on the political spectrum? How did you think about the role of government in the lives of people, and that sort of thing?
Yeah. So, I'll say a few things about that. I mean, first of all, just to say that the pandemic and the response to the pandemic has been a huge learning curve for me, like I think it has for lots of people.
Right.
In terms of, I think sometimes you really need a crisis to really figure out what your values are and what your politics are. So it's been quite helpful in thinking about that. In terms of where I sit, I mean, prior to the pandemic, I would, and still do, I very much consider myself on the progressive left. I'm a big believer in the power of government and the power of groups for social good and for change. But I'm also well aware of the issues and difficulties with power imbalances and power relations, and that power needs to be safeguarded. So we need to be thinking about where the power is, who holds that power, and how is that safeguarded. And this plays out in medicine as well, of course. And I think as a psychiatrist, this is a particularly pertinent issue for psychiatry. I think it is true in all areas of medicine, but in psychiatry it's more obvious. So working on an inpatient unit, which I do a couple of days a week, we look after patients who are detained in the UK under the Mental Health Act. And it's something I think a lot about how healthcare and government and power and legislation interacts with one another in the lives of our patients and the people that we interact with.
I think that's a great introduction, because it's been a long time since I've spent my time on the psychiatry rotation, but I spent a bit of time there when I was a student, and I was struck by one thing, that psychiatry has a very important power, which is the power to hold someone against their volition if that person meets a certain set of criteria, if they're deemed to be lacking capacity, if they are deemed to be a threat to themselves or to others, an imminent threat. And that is a power that society bestows upon your profession. It's a power that, I don't have as an oncologist. I can't detain anyone. And as a podcaster, I certainly can't get people to listen to this show. No, of course, we don't have that power in so many walks of life. The police have that power, I think, to some degree. I mean, I don't know exactly, but I understand that I guess they could detain people for certain reasons. There are checks and balances on that power. Psychiatry has that ability. And there are checks and balances on that, because my brief exposure to psychiatry was, if you were to detain someone in such a manner against their willful consent, for one of these aforementioned reasons, like they lack capacity or something like that, that a second psychiatrist would have to provide an independent judgment within a period of time for that decision to be upheld. And so there was a system in place like that. I wonder if you might talk about those kind of calls you make as a psychiatrist. Are there moments where a patient is saying, I want to go home. It's none of your concern what I do. And you're saying, well, actually, I regret to inform you that in this case, it is our concern, and we have this power.
Yes, yeah, that's something that happens all the time, every day, pretty much, that you're working in an inpatient unit, that will happen. And I suppose, sort of thinking about the power that doctors and particularly psychiatrists have in detaining people, I think it's really important to hold on to that. It's both a positive, coming from a place of positive, trying to provide healthcare to people that need it and protecting people's safety and the safety around them. That's a positive thing. Mm-hmm. But it can also act as a way of perpetrating various injustices in society. So it's not just a benign power. And I think it's really important to hold on to that. So in the UK context, and I'm sure this is replicated in loads of societies around the world, there's a disproportionate detention of black men, particularly young black men, in the mental health system. And once they're in the mental health system, then there's disproportionate rates of seclusion and of restraint of young black men in particular. So this power, although it's coming from a benign place of providing healthcare, can also function in difficult ways. And then in terms of on an individual basis, so it's some very important safeguards in detaining somebody, which obviously are going to be country specific, but also related to that is it's expected that if you detain somebody for their health and in a way that then they don't agree with, then it's expected that there's going to be some pushback from the patient. I think it would be unreasonable. You'd be living in a fantasy world if you thought you could detain somebody and they would just sort of get on with it and be okay about it. Yeah.
And that perspective, I think, gives you. I think those are the two. There are undoubtedly more things you bring to the table, but I think those are the two preconditions. You're somebody who's politically liberal. You believe in the power of governments, when well-intentioned and when well-working, to improve the lives of average people and make their lives better than they were perhaps a generation ago. You're also somebody who recognizes that power is a double-edged sword, and it should be wielded responsibly, and it can and it needs some checks and balances and some buy-in. And so that's how we approach COVID-19. I guess one of the things that strikes me about I think your views on issues, which is different than I would say the prevailing view on Twitter. And there are a few differences that I wish to highlight, and I'll see if you agree or disagree if there are in fact differences. I would say that Twitter, I think a number of surveys show that it is in fact politically left of center. It's far politically left of center. In fact, it's probably close to where I reside on the political spectrum, actually. However, when it comes to SARS-CoV-2, I think there are a number of prominent and frequently tweeted and pushed policies that I believe are incredibly regressive, that are antithetical to, I think, traditional progressive values, that are really sort of talked about unquestioningly. And I'll just give one example. One example is the idea that it's not this is literally what somebody said, which is that it isn't a bad virus that's killing us, it's bad choices or bad people or something. And somebody said something very similar, that it isn't the virus, it's people who don't believe in masks that are killing us. And I guess I would say a couple things. One is, when you have a viral pandemic spreading through civilization, one open question is, to what degree is that in the hands of human beings to control? To some degree, I believe it is our choices that shape it. But, there are, to some degree, it's outside of our control. And actually, I have an essay coming soon where I'm going to try to probe this issue. But the second question is, even if you were to believe that it is largely, 85% of the variance in outcomes is due to your choices, is shame, fear, humiliation, public flogging, is that the way to actually get people to do what you think is best? And I have always felt that, as somebody on the political left, that's just not a baton we wield. If we see a problem in society, sure, to some degree, it may be the individual choices of the individual actors, but we also have some moment where we say, you know what, let's think beyond it. What were all the structural barriers in place that led to this? And you know what, let's ameliorate those structural barriers, because you know what, that might make this a better and more sustainable solution in eliminating the outcome we care about. And so that's one difference. And I think you're somebody who recognizes this. Maybe we'll just talk about this for a minute, and then I'll point out to some other areas that I think we'll.
Yeah. Thank you for bringing it up. Yeah, I mean, I would say that across the sort of the conversation around this, there's been a sort of superficial sort of looking at as somebody is choosing to not wear a mask, or it has a belief around maybe a conspiracy theory belief around vaccines or about doctors or whatever, and it's been just sort of dismissed or ridiculed without trying to think, where do these beliefs come from, and where and how to sort of understand them. And I actually come at this again from sort of a bit of a psychiatric lens, actually, which is that the way that I think about, and I see this playing out in psychiatry as well, which is that when somebody who's mentally unwell, for example, has an unusual belief or a difficult behavior, for example, somebody who might have a delusional belief, you can either view it as just being a random product of a biological illness, or you can think, well, maybe it's that, and it's also telling us something about that person, about what's happening in society. So if we see lots of people who, for example, are choosing not to wear masks, then yeah, sure, we could just ridicule them or whatever, but it's going to be much more fruitful to think, where is that coming from? Is it mistrust? Is it about alienation? Is it about not feeling connected with medicine and healthcare more generally? And that just trying to understand and get to that sort of deeper level is always, in my view, going to be a more meaningful way of engaging with people and trying to enact and affect behavioral change. And then the thing about the fear, right from the start, I was really worried about how the whole approach just seemed to be around getting people frightened and scared of their actions and other people's actions. And, we know that it's relatively easy to sort of get people very fearful. It's much, much, much harder to bring it down again. And, from the beginning, I was worried about, it's likely that the fear of COVID and getting sick is going to outlast the actual pandemic. I'm sure it will do. And I think in order to de-escalate that fear, you need trust and leadership. You need strong community structures. You need these containing things in our lives, and that they're missing at the moment. So that's been a big worry for me. And then also going along with that fear is this. We're sort of being asked to treat other humans as though they're a threat to our lives. If they stand too close to you, they might be threatening to us. That's quite a paranoid way to be living, and I don't think it's very, very conducive to a healthy society. And I'll say one more thing about it, which is also that I do think there are obviously really complex ethical issues around this. So some people might say, well, if you don't wear a mask, if someone's not wearing a mask, they're killing somebody else, or if they've not following all the rules and somehow they're killing other people. And this is something I think about a bit again in a psychiatric context, which is around we have an obligation to not be negligent human beings. We have an obligation to take care over our behavior and just try to sort of do the right thing. That is not the same thing as if we have a slip in our behavior and someone else becomes infected and if they die or someone else gets very sick. That's not the same thing as killing that person. That's just human beings living through a pandemic. So those were two things. We of course we do have a duty to be careful.
Others, yes.
Yeah. We have an ethical duty to be careful. But if we slip up or other people slip up or we're just humans and live out our needs, and people get sick, that is just being human and living through a pandemic. That is not being a murderer.
I agree wholeheartedly. I mean, I'll just say a couple things on this that, I mean, I think I might have said before in a different forum. One is the same liberal who will say that the person who's not wearing a mask is killing someone and that they are the bad person and they murder blood on their hands is the same person when they actually meet someone who has killed somebody is willing to say things like, although this person committed this crime, we should not forget, this person was abused as a child. This person had no upward opportunity. They had no role models in their life. They went hungry many nights. They were beaten. No one cared for them. No one educated them. They joined a gang because of the only sense of community. And then ultimately they ended up committing a murder at the age of 22. Yes. Did they commit a crime? Yes. However, they're also a product of that upbringing. And the same kid, if you had put in a different home, maybe it wouldn't have happened. And so yes, maybe we should have rules about this crime. But maybe we should also think about all the structural injustices that led this kid to this moment. That's the attitude that I believe in. Okay. And that same person, on the mask person, they don't see this mask person as, this is somebody who was born in the deep south. This is somebody who was born in a region where all the factories left. Their father lost their job. Their mother has no upward mobility. Many years they felt as if politicians made promises and never delivered. And then one year, this guy comes, this smooth talker, this con man, and told them that the reason you are suffering is because of the other. It's because of these people coming taking your jobs. That's why you're suffering. So this person joined the group where they felt included. And then this person felt like, the mask doesn't work because this person modeled it for them. And this person doesn't take it seriously. The same, if anything, there's a lot of analogy between the person who joined a gang and the person who, it's a series of structural failures too. And sure, to some degree, they're being on the margin, not doing, I think, a considerate thing for other people. But surely you should extend some of the same compassion you extend to the gang member to this person as well. I mean, that's just my view, I guess. Yeah.
Yeah, no, I agree. And also I think there's a sort of lack of understanding, or even ignorance actually, about human behavior, and also how these structural inequalities play out on our behavior. So, to give an example, most of us who are have limited our social contacts, and who are in the professional class, we are having Zoom calls. We are having Zoom quizzes. Maybe we'll be logging on to courses on Zoom and doing those things. But a lot of people do not have Wi-Fi. They may rely on data. A lot of people rely on data from their mobile phone on a pay-as-you-go to access the internet. That is expensive. Mobile phone packages are very regressive. If you have a contract, you pretty much have unlimited data. If you're on pay-as-you-go, you don't.
Right.
So you just would not be able to afford the Zoom calls and that contact. So what are we asking people just to literally completely isolate themselves for months on end? No, of course no one's going to be able to do that. So then we're surprised when people are disinterested in the rules or don't follow them, but whilst we are, happily having our Zoom calls,
And I think you're hitting on it. And just to push it a little bit further, it's much easier to follow the rules when you have money. Of course it is. You have a bigger house. You have more space. You have a bigger yard. You can have people in the backyard for drinks and stand 20 feet apart. I can't do that. I don't have a yard. You can have Zoom calls. You can be crystal clear clarity. People in households where there are, many people in the household, they can all have their own rooms. They can have their own space. They can close the door. They can get food delivered. They can get all these services. But if you don't have money, it's a lot harder. And so when somebody says, 6 people are having picnic in the park and drinking, and they get a picture from an angle where they look like they're close, you can always get the angle. They always look like they're close. And then they put them on Twitter and say, look at these sons of bitches and why they're leading to the whole plague. I think it's sick. It comes from a place of fear and anxiety, and it's not a rational response to anything. It doesn't help anything.
Yeah, and there's a disconnect between, I'm really fortunate in that. So as well as working on an inpatient ward, I work in the crisis team, mental health crisis team, and it's all home visits. So two days a week I do all home visits in the borough, and we'll see everybody who's in a mental health crisis. And you get a sense that that many people living lives where it's just the reality of their lives is not connected with the government legislation. It's just not possible to go into lockdown and never stay at home and only go out once a day when you live in one room with 2 kids and it's a bed sit. And it's just not a thing that's possible to do. So, and then of course there's all the issues around how much people understand the rules, language and all these sorts of other things. And I'm sort of increasingly becoming concerned that when you have a society where the government legislation is just a complete, departure from the everyday lives of people, that's just a fractured society. It's not good governance. It's not rooted in our lives. It's not reflective of actual things that people can do, and it just causes that friction, just causes anxiety, alienation, mental illness. It's just it's not a healthy place to be, really.
Yeah, I want to push on this one more direction. I saw somebody tweet something to the effect of, if you believe that people should have the freedom and rights to make some choices that increase pandemic risk, then guess what? You shouldn't support drunk driving legislation, because drunk driving legislation is us taking away freedoms to protect other people. So if we can do it there for drunk driving, we can take away the freedoms for commerce and travel and meeting up to protect people from a pandemic spread. And I thought to myself, I agree that in both situations, society is saying we're going to sacrifice something for the greater good. But I also wanted to say, do you really think that somebody's right to get plastered and get behind a wheel and drive is the same human desire as someone's desire to hug their own mother? You really think those are the same thing? Or someone's desire to educate their child? And to me, it bothers me a great deal if we're conflating these things. A rule that says you can't have 7 drinks and get behind the wheel, which, by the way, let's be honest, is actually, very selectively enforced. I mean, it's not rigorously enforced. For my knowledge of it is, I don't see them doing a lot of enforcement, but it is a rule. When they catch somebody who is totally trashed, they're going to put him, I don't even know what the punishment is, actually, to be honest with you. I don't know. I don't engage in the activity. And there are alternatives. You can take an Uber. I mean, you can take a taxi. You can take a bus. Versus somebody who's saying, I haven't seen my 80-year-old mother for a year, and I want to see them, and that's a violation of the rules. And you want to say those two things are the same thing, the same moral, spiritual thing? I find it troubling. I feel like we're lost. Where's our compass?
Yeah, I agree, and it all gets sort of meshed up. So you see people say, "Oh, people just complaining about their freedoms. Can't they just wear a mask?" And it's like, okay, wearing a mask isn't that big an imposition for most people,
right?
But that is not the same thing as saying you're not allowed to see your mum or your partner, or you're not allowed to have a new sexual relationship, or for months and months on end. They're just not the same thing. It's just completely different.
It's not the same thing. I don't know what to say. It's not the same thing. Yeah.
And I think, we don't have, we have, various, from my perspective, I think this whole thing should have been done within a framework of sort of civil liberties and civil, and various rights. And we of course we have a right to life. We don't have a right to live without risk. We don't have that right. I don't have the right to say that every day I'm not going to be exposed to any risk at all. Again, this also ties in with psychiatry. If I detained every single patient that said that they may possibly harm someone or harm themselves, then we would be detaining everybody. That's just not the world that we live in. So I think that the right to life, which is of course completely, something that needs protecting, gets conflated with the right to live without risk.
Yes.
We don't have that right.
And one more on this point. I recently was talking to an older person. This person is in their 80s. Okay, it's an older person. And this person is not an English as the first language speaker, and this person was born in another country and moved to this country. And this person had plans to meet up with teenage grandchildren. And these teenage grandchildren, I don't know, but I got the feeling that they weren't exactly sticklers for the rules. I don't know what these kids are up to. They're probably meeting, they're kids be kids. What can you do? I mean, you can shame them on Twitter, but I mean, what can you do? I don't know. They're doing stuff. Okay. So then I was talking to this elderly, person, and I said, I tried to strike a balanced position on this issue. And I would say, having looked at the outcomes of SARS-CoV-2 in someone of your age, I would be seriously concerned. And I would, I'm not sure you should go, meet up with these kids. I mean, you're very vulnerable. I mean, that's a serious risk. I mean, if you were to get COVID, we're talking maybe 1 in 4, chance of death, This person who didn't speak English extremely fluently told me they squinted at me and said, "Don't you worry about that." And I said, "What do you mean? What do you mean? I don't worry about that." I said, "Don't you worry about that." And then I said, I mean, I have to. I'm like, I'm a doctor, I'm worried for you. I'm worried, And they say, don't worry. And they say, no. And they just shook their head at me. Okay, that was the interaction. What am I to do? I mean, I don't know. I feel like I did my part. I pointed out that there is a risk, but this is an 85-year-old person, and I've also been raised to respect my elders. And I'm not judge jury. I mean, what would you say to such a person? I think there are people on Twitter who would say very drastic things. I should have detained that person. I should have, used the force, all the force I have to make this person not do this. Is that my right? Is that my duty? What do you think?
Yeah. Well, it's interesting to hear that, because for one thing, it's really nice to hear that short anecdote, because I feel that the voices of older people are completely missing from most of the debate. Completely missing. And of course, they're going to be as diverse as everyone else, and some will absolutely be, full for a full lockdown, criminalizing everything. And there'll be others that see it completely differently, but they've not been centered. And again, this comes from the that sort of progressive thing where we really think about, we shouldn't just talk about groups that are vulnerable or affected. We should center their voices. That's been completely missing in my view. Yeah. Another thing is the care homes. There's another word for them in the States. Assisted
living nursing homes. Yes.
Assisted living places. Yeah. Care home sort of places. Lots of them have had visitors banned for months and months and months. And I don't think I've ever, not once, seen a care home resident be interviewed in a major sort of media organization about what the experience is like for them not being able to see visitors. I think
it's not good. It's not good. Some of these people have their remaining life is measured on the order of 1 year, 2 years. And the imposition is half of your remaining life. You don't get to see anybody. I will just say one thing on this point. One of the things I wrote that I still feel very strongly about is that if people are vaccinated, they can take greater risks than people who are not vaccinated. I still feel that is the right answer. I got some flack for it. One of those risks is to have. I know this to be true. This is somebody I know that. Colleague of a friend was basically the person in the care facility has had and recovered from COVID. Both of the people who want to visit that person have had vaccinations for COVID, and the system will not allow them to visit. And I was thinking, my God, at some point we have to say, this rule makes no sense. You're really taking away something from human beings, and everyone in this picture has had or been vaccinated for COVID. They're not. I actually think the person who had COVID in the nursing home got COVID and then was vaccinated. They got both. That's an extra boost. And nothing is. I don't know what to say. I think it's. I don't know what to say. I'm really flabbergasted. I'm just totally flabbergasted when I see something like this. I'm shocked. I'm morally hurt. And I really wonder about all the people complicit in enforcing this rule. Who's got the courage to enforce such a horrible rule?
Yeah, it's against sort of good medicine, obviously, where we weigh up risks and benefits. It's, it's got this sort of feeling of sort of, bit of, tyranny of bureaucracy, the bureaucratic inhumanity sort of thing. And then, the other thing which I've been thinking about is, of course, it's a difficult issue. They're the most vulnerable group to COVID, not the people that have just had COVID and been vaccinated, but, the group in a wider sense. But underlying it all, there's also been this sort of denialist fantasy where we don't talk about death, where we think that people in there who live in a care home can just wait for a year to see their relatives. They can't. Their lives are short. Some will not last a year, or in a year they may have more significant cognitive impairment, or whatever. That at that age, not everybody can just put their lives on hold. And it's just this sort of fantasy, I guess, that we can do that we can just expect everybody just to to postpone everything. It doesn't answer the question, because of course it's a really difficult issue about visits in institutional settings. But but it's. I do think some principles, could be followed. The most important one is centering the voices of the people.
Yeah, I think you make a great point that, and what is Twitter but a bunch of young people telling you what young people think? Because that's who's on Twitter. How many people who are really in that I don't know any 80-year-olds who are tweeting up a story. No, he's an 80-year-old, but he's not on Twitter. But you're right. I think that the dialogue is it speaks on behalf. And the other thing that I hate to say is, the views around risk and my parents' generation is not the same as our generation. Something has shifted in the zeitgeist, in the generational perception of risk. This 80-plus-year-old immigrant has a very different sense that they were conveying to me with a very dismissive, like, don't you worry about that, buddy. Which I found rather sweet and humorous, even though I said what I wanted to say, that, there's a 1 in 4 chance if you get COVID, you're not going to make it. But this person told me they didn't really care. Okay, but I wanted to shift gears for a second. I wanted to talk to you about the role of the state and what the state means in Western democracy. And I think it's easy. I think there's a few things to say. One, I don't think people who, well, I guess I should put all my cards on the table. I have an article that's going to be coming out tomorrow, and it says harm reduction or zero COVID. And I basically make the argument, you'll see it tomorrow, that zero COVID, I think, it's great for the places that have achieved it or close to achieve it. Sure, I'd love to live there. To keep achieving it, they're going to have to put walls up and regulate people coming in and out, and they can decide whether or not they believe that's worth it to them, whether or not that liberty is worth it. But it's not, I don't believe it's realistic in the United States. I just don't think it would happen. And I was reading what zero COVID people say to get to US, which has 100,000 new diagnoses a day, to get them to zero COVID. What will it take? And they're like, basically, you need a very hard lockdown. I was like, a hard lockdown? I was like, do you know what's going on in this country? There's 40%. We can't even lock down the fucking Capitol building. You can't even lock down the one building. One building, you can't lock that down. You want to lock his whole thing down? What do you think is going to happen? It's going to blow up in your face. It's going to blow up in your face. There are people who don't take it. There's states they don't take it seriously. They don't want to do anything. You think you're going to lock those people down hard? How are you going to do it? Put tanks in the street? Shoot them if they come out? What are you going to do when they come to protest? You're going to shoot? You'll have to shoot them, because otherwise they're going to get protest. And then my other point about, I'm being a little dramatic, but maybe I'm not being dramatic. My other point about lockdown is not like other interventions. It's only as good as the least compliant cohort in it. And if there's a faction of the people who are not going to participate in it, the virus will spread in that faction, and all y'all can lock down all you want. The willing can lock down, but it won't do anything if 40% of people don't participate at all. And so anyway, I talk about this, and I just think it's just not, I don't even know. Wuhan, China can do it because that is a totalitarian state. Are you crazy? It's a totalitarian. They can shut the whole place down, and they can shoot you if you violate. We can't do that in the West. We can't do that in democracy. So if you really acknowledge that, I think harm reduction is the only path forward. Anyway, so this is the first part of what I wanted to say, and the next point I want to say is what we have done. Many people have participated in what we've done. By egging it on, I think, on social media, etc. It is leading to the worst, inequality that you're ever going to see in your life. It's going to come. And this inequality makes for a political situation that was already shitty, and it's going to be absolute shit. When you make poor people poorer, and you take away their education, and you hold them up, and then you don't give them anything, there's no stimulus checks going. They are not going to like it. And when they go to vote, they're going to be voting for the despots, the tyrants, the demagogues, the con men. They're going to vote for those people. And you're breeding the ground for, I think, what to come will be a very unstable political situation. Anyway, these are just, some of the things that I'm worried about along with the virus. I wonder what your thoughts are on this broader issue of the power of the state and politics and where we're going.
Yeah, I mean, a few things to think about that. I mean, one is that I think the debate has been way too narrow. It's been framed as a medical intervention, really, with lots of sort of quite a few sort of doctors and epidemiologists and so on pushing it as a medical intervention, and it's sort of like lockdown or no lockdown. But very little debate on, or even interest or curiosity about how lockdown is constituted, what's the democratic process, what's the role of the justice system, what's the role of borders, all these things are just sort of like ignored or put to one side. I mean, and then, yeah, and I would sort of like to see whenever anyone sort of suggests lockdown, I always sort of want two things to be acknowledged, which very rarely are. One is that enforcement of a lockdown, if you're using a criminal justice system to institute a lockdown, which many countries have, enforcement will always 100% will be disproportionately enforced, and the people the state has the most control over. That's just how it works. The people that the police are able to control will be the ones that are locked down the hardest. So in most countries, that will be sort of middle class, wealthier people, doctors, free to go out to work. Most live in their own homes. No one's probably going to be checking on how many times a day they leave the house. But if you live in an over-policed community where the police are breathing down the back of your neck anyway, or even more so if you're in an institution of some type, a mental health facility, a care home, anything like that, you will be completely locked down. And that disparity in restriction on liberty is just so profoundly unethical in my view. And then the other thing is that there are always going to be people that are beyond the bureaucratic reach of the state. So you could put in as generous an economic package as you like, but there will always be people that are not able to access that. Either they're undocumented, perhaps, or they have a learning need or a mental health difficulty, which means they're not able to navigate that bureaucracy, or for whatever reason, or have cognitive impairments. But there will always be people that live beyond the bureaucratic reach who will be destitute. So you have to acknowledge those two things, I think, and they're mostly left sort of unacknowledged.
Yes.
And then there's the whole, it's just surprising to me. There's just whole political histories of how states are organized, how people function, how our power is distributed, the value of borders and what they mean. And it's just sort of like breezily overlooked. I don't really have any other way to describe it. And I mean, in the UK we have and in the US, in the UK we have this really stark example that everyone's like, okay, the UK, well, not everybody, but the people promoting zero COVID say, UK is an island state just like New Zealand and Australia, so we should have been able to lock down. And I'm sort of thinking, have you not been paying attention to news for the last 3 years about Northern Ireland and Brexit? There is a land border. Where would you put the border? There's been wars have been fought over that. In the US, was rightly, so much concern around building a wall between the US and Mexico, and now that's something that some progressive people want. I mean, it's hard to get your head around. And then I have to say, for this, I found Twitter helpful because when the first lockdown happened, I just had this, whether it was necessary or not, I had a sense of abject horror. It was just the thought of police being on the street, potentially controlling how many times a day you leave your house, borders being closed. I have come from a family where immigration and crossing borders was essential for survival, and the thought of just borders being able to just suddenly be thrown up, it just freaked me out, and And I felt quite alone, actually. Do other people not feel the same, or are other people just very relaxed about this? And it actually has been helpful on Twitter, sort of connecting with other people that are similarly have similar sort of progressive politics, but also have this sort of horror with, border closures. So, it's been helpful from that point of view. But yeah, it's quite something. This sort of. I see it as sort of medical overreach, just not really being interested in the role of the criminal justice system or even thinking much about it. I don't know. I don't know how to make sense of it.
I feel I agree with everything you said. It's really resonating. If something is done in the name of public health, it feels like you can get away with things that you couldn't do in the name of other things, you know? You can get away with border closures. You can get away with some of these policies. I don't know. I guess I would say that in addition to everything you said, there's an added dimension that I think makes the problem even more challenging, which is that we are not even allowed to talk about it, I believe. I mean, I will make my argument why. There have been a few people who offered alternative points of view about how the pandemic is going, how we ought to respond to it, and there is a fierce effort to get them to stop talking, not to engage with them, to hear them, to engage in some dialogue. And some of these things, you know, I see a middle ground. I see where there are, you know, I don't agree with everyone who's speaking. But I don't like that the answer is to demonize and silence. And, you know, I've written a bunch of things on censoring, and that, I mean, the things that jump in my mind are, you know, Carl Hennigan, he doesn't believe that masks are proven to have benefit. That's his point of view. I personally don't care that much, to be honest with you, about the evidence, because right now I'm wearing pants. When I go out here, I'm going to wear pants. Why do I wear pants? Has anyone ever proven that wearing pants makes it better for anyone? Have you ever proven that? No, they don't prove that pants make things better, but I'm happy to participate in the pants wearing as a common courtesy so people don't have to see my scrawny legs. Similarly, at a time of pandemic spread, when it's coming out of your beak, I'm happy to cover up my beak and prevent it from spreading. And actually, I do like the anonymity because I'm a misanthrope at heart. So I like the fact that I actually think, I mean, it cuts both ways, obviously. It's also, sometimes you misunderstand. Anyway, I'm happy to do it. But Carl Hennigan thinks it's not that good. Okay. And he thinks that, you know, there's no randomized data that supports it and that kind of thing. He has his point of view. He's, I think, a consistent guy for many years. He likes randomized data. So he, you know, this may not have it. It's precautionary principle and other reasons, but it may not have the type of data that he likes. And so then the Danish mask study comes out, and it's a null study, and he writes that the masks do not significantly reduce spread. And that's one interpretation. I have my own interpretation. I wrote my article where they say, you know, it fails to find a 50% reduction, but it's not powered to find smaller. So I have a different way of looking at it, and other people have a different way of looking at it altogether. We're all entitled to that. However, his way is labeled fake news by Facebook and is removed, you know, it's labeled fake news. We have decided he is wrong. John Ioannidis' video where he says the IFR of this is in the same, quote, ballpark as flu, whatever a ballpark is, that's deleted by YouTube. These aren't just random people. You know, these are people who have been in the academy for a long time. They do not have a track record of saying the kinds of things that would get a consult from you. You know, they're real people. They just have different points of view. I think another point of view that has been heavily demonized is the point of view that these restrictions are not worth it. I actually don't fall in that camp. I genuinely don't know if the benefit harm of the restrictions is positive, negative. I think I wrote something on that recently. Like, I genuinely don't know. I do think, however you implement them, there has to be checks and balances. There has to be some way to gauge what people want and what they're willing to do. I don't think it's all, quote, follow the science. It's not all follow the science. Science is not a guide to life, especially policies. Policies is always what people want. And if everybody in a society is like this 80-year-old person saying, don't you worry about that, you know, then you really are not justified in a lockdown. Now, if this person is a minority view and most people think it is reasonable and there's some participatory way to demonstrate that, then I think you are entitled. I mean, this is part of the political question. Anyway, I've been rambling, but I guess what I want to say to your point is, yes, I agree with everything you said. I have felt the same frustration. Every day when I go on Twitter, my blood pressure goes up because I feel like the loudest voices are the ones saying all the shit that I don't like to listen to because it's fucking crazy. I mean, they're really out of control on the power of people to shape lives of others and confident that it's guaranteed to work, and everyone who disagrees with them is spreading disinformation and they want to shut them up. I mean, it really troubles me. There's one last thing I wanted to say, but I'm sorry, I'm losing my train of thought. Maybe it'll come back to me, but I'll let you say what you're thinking.
Yeah, you know, I had sort of two things to respond to that. I mean, one is from a scientific perspective, and you know, this is also good medicine. I think it's to be really transparent about uncertainty, and so if you claim certainty when it's not there, yes, which is a case for quite a lot of these interventions. Oh, yes. Some people will lap it up, and maybe that's a derogatory word. Some people will find that helpful and say, yes, I'll follow this intervention because people are telling me it's certain. And other people will look at it, realize there's a bit of uncertainty, and then go to conspiracy theories if we're not transparent.
Yeah, or be really angry with you, very angry, because there's actually, to be honest with you, if you tell me you're more certain about something than you actually are, I get really angry. I mean, I just want you to be honest with me, and because I think you think I'm an idiot. I mean, that's how I feel. Yeah.
Yeah. So I think it's. So when you see people making claims about interventions which isn't backed up by the evidence, or making the claim seem much stronger than it is, and people start doing research and then which is welcome, but it can feed, if we're not transparent or open, it feeds conspiracy theories in my view. And the other thing about the power relations is I've seen some people, some very eminent public health and doctors, other scientists, sort of say, people are saying that I'm just trying to control them. That's just conspiracy theory. I'm not trying to control people. Like, these people are crazy. Why are they saying that? And I think that shows a real sort of lack of understanding of power relations, which is, it's not about whether you as an individual are purposefully going out, like, controlling people like they're in a video game. Like, no, of course, you're just trying to do your well-intentioned job, but it's about looking at the system within which you live and within which you work, and your work is organized, and thinking about, do the policies that you're writing enact controls other people? And yes, they do. They enact absolutely huge control. And so if you have that control and you have that power over people's lives, then at the very least, you need to acknowledge it.
Acknowledge it, yeah.
That's a start. And then follow all those other principles. Be transparent about it, reflect about it, build in safeguards, get second opinions, don't shut the opposition down, expect pushback. It's completely, do people really think you can shut down a society and not have pushback? No, that would be, I don't know what the right word is, just terrifying. It's important that there's pushback.
That's one of the things I saw somebody tweet, that this person said, the biggest shock to me about this pandemic is that professors at Oxford, Stanford, and Harvard disagree with what scientists say saves lives. And I want to say that's not a surprise. That's an inevitability. You have a situation that has never happened in 100 years. You enact measures that, to my knowledge, have never been enacted in human history. In any pandemic, these kinds of measures have never been enacted, in part because people did not know all the things we know today. They may be actually beneficial measures, but also in part because nobody had the power to do such a thing. Historically, they enacted all sorts of things in the plagues, all different, but they never at this sort of broad scale. Within 3 weeks in March, every place on Earth shuts down. That I don't think has ever happened in human history. And then your question is, you're surprised that some faction of educated people view these trade-offs differently. That's ridiculous. Of course they were going to view it differently. No matter what you did, if you did the opposite, they would all be easy, because human beings are bound to, in our wonderful diversity, to view these things fundamentally differently. Here's the point I wanted to make to you. I want to pick your brain on the masks. There's a first order what the masks have done, which is, as I say, I have one right here. And I'm going to wear it in a minute when I have to step out. I think that they are a very, as you say, it's not much skin off my back to wear. Very similar to wearing pants. I know there's some study that said it doesn't lower my O2 sat. Well, I wasn't too worried about it lowering my O2 sat, to be honest with you. But it doesn't do that. Okay. It is what it is, However, the moment you brought this into the picture, you have a visible symbol of how you view the pandemic and the response. It's visible. I see it. I know. You see it. You know. It's different in this country. I used to live in Portland. I live in San Francisco. I drove down, and what I noticed was when I was leaving Portland, it was like 5:30 in the morning, and this guy was biking up this hill. There wasn't a person for 1,000 feet within sight, and he had on a mask, and it was soggy with sweat, and he was huffing and puffing. That's his commitment to curb pandemic spread. I go 5 miles out of the city, I'm in Trump-Pence country, and they ain't no mask in sight, and it was like Mardi Gras when I stopped to get some gas. And then I got closer to the Bay Area, and as I get closer, I know I'm nearing the city limits when I see more masks coming. Okay, so it's a visible symbol. Well-intentioned people have gravitated to a visible symbol, and I don't even know, 15% of health policy Twitter was wear a mask, wear a damn mask, just wear a mask, just wear a mask. And what I believe it did, my mask is red, just like the red cape can distract the bull, the red mask has distracted liberal public health experts to focus inordinate amount of time on this one visible intervention. And what have we forgotten? We've forgotten that the people who are dying of SARS-CoV-2 in this country, they're not average people. They're more likely to be line cooks. They're more likely to be Hispanic. They're more likely to be black. They're more likely to be in tighter quarters. So all the time you spent telling people to wear your damn mask, you could have been telling politicians, give people some support. Let's open up all the empty office space, and let's turn it into some places to house quarantine. So people who are sick at work, they can go quarantine for 10 days. Let's pay them to quarantine. Let's incentivize them if they're really fevering to go into this building and quarantine. You could have paid people stimulus checks. You could have provided food. You could have provided outreach. You could have actually invested. You could have been, instead of saying wear a damn mask, you could say let's have universal broadband Wi-Fi so every kid can actually use the laptop. You could have fought for those things, but you fought for the thing. They tricked you into thinking that this was the thing to fight for. It was visible. It was a visible symbol, and you fell for it. Not that it's a wrong thing, but it shouldn't have taken that much energy. The energy you sunk into it was disproportionate, and that energy could have been spent on actual progressive policy that actually provides resources to people who need it. And that to me is the second order thinking of the mask, is that it distracted you in a way, and people on the other side who didn't want to invest in those other things, all they had to do was thumb their nose at the mask, and you chase them like the bull chasing the red cape. I wonder what your thoughts are.
Yeah, I mean, I have. I mean, it's first of all, a mask is. Obviously I'm aware I'm not coming at this from a public health professional perspective, but the way I see it is, a mask is one intervention among others.
Yes.
And that's how it should be viewed. It's obviously not as an intervention that touches the structural drivers of the pandemic, the things you mentioned, economic and racial inequality and housing policy and so on. Obviously, it doesn't touch those things. I think it's my sort of non-public health opinion is I sort of assume it's only going to help a certain amount, because we know that the riskiest transmission is in hospitals and in households. In hospitals, we're definitely going to wear masks, and most people don't wear masks at home. So,
it doesn't have 100% efficacy. Yes, it is. I don't know what the percentage is, but it's not going to be. Yeah, exactly right. I think that's another thing people miss. Yeah, it's not 100%.
And I feel that if you are, once a public health measure becomes identified with a particular political group, yes, I think it sort of loses its efficacy, because it becomes, for public health measures to work, obviously you need high uptake across the society, and if it comes too closely identified with a particular political grouping, then it's going to cause problems. And then from a sort of medical perspective, I don't know whether I'm just too I don't know what the word is, sort of too flexible with how I approach medical problems. But if I have a patient, and public health is clinical work, but at a group level, if I have a patient who doesn't want to do something, doesn't want to take a medication, for example, I don't just sort of flog them until they take it.
It never works. Are you crazy? Yeah, it never. I mean,
you try and find other solutions and workarounds and think, okay, well, this won't work, but let's modify your risk in this other way. And I just would have thought that from a public health perspective, that would be the thing. Okay, this intervention isn't working for this group. Let's try and understand why. Can we try and support them? And if it's not, then let's focus on the other super important things. And probably driving things a bit more. But I haven't, I've actually purposefully, maybe I shouldn't have even commented here, because I've purposefully tried not to comment too much about masks, because I just feel, it's a polarized debate, but in a sort of unhealthy way. I feel like a polarized debate around, I don't know, borders or supporting people to isolate. These are things which are battles worth fighting.
Yes.
Masks and whether how nuanced or not our mask policy is, I just feel like it's just a distraction.
It's a it's always a distraction. Yeah. I mean, I only discuss it because I think it is visible symbol, and we talked about it too much. My whole point is we talked about it too much, and we didn't talk about things that actually do matter. And I think it was Wes Pegden who actually tweeted something like, there's probably news organizations ran 10,000 polls about whether or not you'll wear it and when you'll wear it, and we wear it here and there, that you wear 1, you wear 2, you wear 3, you wear 4, I do not like them no more. I mean, no, I don't know. They ran all these polls, and he said, how many polls did they run? One question: if you have a fever and if you have a job, can you stay home and actually make ends meet? I don't think they ran I don't even know if they ran that one poll. Not one poll. If you feel sick and you are a cook in a restaurant, do you have to go to work? Yes, no. No, all the polls they fixated on it, which I think is ridiculous. But I mean, I think you're right. It became polarized, and I don't know. I think one last thing to say, because I know our time is up and I have to run, but I wanted to say this about what you're saying about politicking. The thing about Twitter is you can only get so many followers when you talk about certain subjects. If you talk about psychiatry, there'll be a certain size you get. To talk about oncology, a certain size. You talk about biomedicine broadly, a certain size. If you want to level up to the big level, you got to talk about just naked politics, Trump and Biden and Theresa May, and you got to talk about political figures. That's the way to get to the biggest level. And then if you want to talk public health, you got to talk about social distancing and masks, and you got to talk about precautions, and you got to talk about quarantine and these things. And I will say, I believe that almost every single person has succumbed to this temptation, is their Twitter feeds are a blend of public health and just total politics. That Trump said this on Tuesday and it's wrong, Biden's doing this and that's good, and you should do this and we should do this. And I think that, they are losing so much of the audience because, and what I want to say is two things. Like, one, I think it does damage to the public health to make it wedded to politics. I think, like you say, the moment it becomes wedded, it's a horrible situation. And I also think the environment has incentivized them to do it. They don't see how they're being a pawn in Twitter's game, because the moment they start going back and forth on tweeting such topics, the followers start blowing up, the retweets blow up, and they're getting a reinforcement. It's like a classical conditioning experiment. They're being classically conditioned to wed these things together, and they do not see that does societal damage. Okay, I'll give you the last word. Yeah.
Yeah, well, no, I just, from my perspective, I really do believe, maybe naively, I believe in the power of groups to regulate each other, to regulate one another. In-person groups, that is.
In-person groups, yeah.
Yeah, I mean, I know that's obviously not safe or always safe or possible, but I do really believe that. Oh, and if not, in person, then there are ways of having groups online, and groups where we are a bit different to each other, workplaces and other societal structures where groups meet. We moderate each other. We improve our thinking and test out ideas. Twitter, doesn't function in that way. It's not and many of the other and our interactions have been reduced mostly to sort of one-to-one as a result of the sort of restrictions. And so we're not getting that, and we're not able to participate in the community organizations at the moment in the usual way. So we're not getting that sort of group modulation effect. So I feel that it's a lockdown society, and which is why I really feel that restrictions should be for as limited a period as possible, because a lockdown society predisposes us to some of these more sort of rabbit hole extremist type thinking, where you just escalate, and we're all vulnerable. I'm sure I'm vulnerable. We're all vulnerable to it in different ways. But we need each other. We need groups. We need to modulate we need to meet. We need to discuss these things, getting a number of retweets doesn't count as discussing and thinking through an idea, I'm afraid.
Yeah. I think, I want to thank you for your time, and I want to thank you for your tweets, because I think on a number of occasions you articulated something that I've been feeling and having difficulty articulating. I guess, even pre-COVID, if I were to put my cards on the table, I've just never been in the moralizing business of telling people what they should or shouldn't do in their lives with absolute certainty, because the truth is I don't know. And I guess I would say COVID has shown me a lot of things I don't know. I don't know which of the 100, probably, I said in a recent article, 10,000 different interventions, which ones made a difference and where and under what circumstances and how much? I don't know. Which were the behaviors that people could have reasonably averted? And which are the behaviors that, people have to be people to some degree. We can't just turn off and lay in bed all day. There's some balancing act. Which were the ones we could have done differently, and which were the ones that we really had to sate fundamental human needs? I don't know the answer. And so I don't like to judge. And I also think the other things, people have different appetites. We never even like talk about, like, literally you go eat with somebody and two people will eat different amounts of food. Similarly, people have different appetites for dating, for sex, for spending time with parents, for spending time with colleagues, for chatting. And if we are starting judging people for quote unquote not being good, following the rules for these different things, it's just like judging somebody who eats a little bit more than someone else. It's sick. It's just a sick thing. And then the last thing I'd say is there must be some fraction of what the virus was going to do. It was just going to do. It were dominoes that are already falling. Like nothing we could have done would have some amount of it. I mean, I believe that to be the case. And in an essay, I'll argue. And I think it'll take a decade before we actually quantify what was that amount, 15%, 20%. I don't know, but it'll be some amount. It was going to do that. And I think having some recognition that, that some of this is stochastic, that's random, and some of this was inevitable, I mean, I think takes the edge off. And I think, I don't know, in all the great plagues, when I'm reading little history books, one of the things people do is they always believe it was something somebody did. It's easy for human beings to say it was your immorality that led to this problem. It was you. It was that baker. It was that person. We're just so good at that. And I don't know. I told somebody recently there should be a story of like aliens park outside the Earth and say, we're going to invade you guys. We're going to invade you. And then before they even invade, like people will just tear themselves apart, like just debating. And then this guy sent me a Twilight Zone episode that was almost essentially this exact premise made like, I don't know, 50 years ago, an older gentleman. Not that old if you're listening. But anyway. So I just want to say I want to thank you for your thoughts and commentary, and I'll let you give you any closing thoughts.
Yeah, no, thank you for inviting me to talk. Really, it's been a pleasure to chat with you and to think a bit more about some of these issues. It's as I said at the beginning, it's been horrendous in so many ways, and the catastrophic loss of life. I mean, it's awful. But I think it does sometimes take a crisis to sort of help you think through your thoughts and understand your values and ethics and things. And as you say, I've never been in the business of moralizing. There is a tendency, that aspect of medicine, of how medicine is practiced, which can lead to that. And I've never sort of been drawn to that, but this is sort of it's in some ways it's been helpful to talk things through with you and other people, and think about these ideas. So yeah, thank you.
Thank you, Robert Freudenthal. And people should follow you for some respite in the sea of Twitter. Well, thanks so much for doing this. You've been listening to Season 3 of Plenary Session. Plenary Session is produced by Kiana Klossner. Music by Ian Straley and Audrey Tran. The views expressed on Plenary Session are those of whoever said it and no one else. Plenary Session is not medical advice. Follow us on Twitter at plenary_session. Until next time.